Hi there folks, welcome to this first video in a series that I'm putting together on neuromusculoskeletal health. My name is Joseph Devlin and my aim in this series is to democratize the knowledge that is common with health professionals and put it out to the public about the neuromusculoskeletal system. Now, you might be thinking, what are you talking about when you say neuromusculoskeletal system? So the purpose of this 10-minute video is to explain exactly what I mean by that, and in particular go into the anatomy, the physiology, and the pathology, or the structure, the function, and the disease process that affects the soft tissues, the nerves, and the bones around the body. So what am I talking about when I say neuromusculoskeletal? I'm talking about neuro meaning nerve, and that is the sensory and motor data which comes from your periphery or from your skin, your fingertips, from your toes up into the brain, and then the motor information, so the signals down to the nerve. So that is the thin data cables, kind of like you plug your phone in and you might get some information from your phone to your laptop, or vice versa. You might get some information going both ways. You might use the data on one or the other, and that's what the nerve is doing. The nerve is transferring data. We're looking now at the muscular system. So really briefly, muscles are contractile tissue. They shorten and they lengthen, and you are thinking about blood supply to this tissue. And you're talking about the soft tissue, the packaging or the wrapping around. So the fascial system, which we're going to go into future videos. I'm going to do a video on that, in particular around trigger points and how trigger points affect the fascial system and how they cause contraction and pain, and can often lead to chronic pain, and some might say that's where kind of trauma is held in the body. We're looking at the skeletal system, so bones in particular, the joint ends and how they meet other bones, and the ligaments that hold them together. So bones are those solid structural really kind of stone parts of the system. They don't bend, they tend to break, and I'll be doing a video on what happens when bone and ligament is injured, actually, because a couple of my friends have recently had injuries to their ankle, so I'll be doing another video on that. You'll be able to check that out in this series. Okay, so if you haven't switched off already, if you're not bored and you haven't gone on to something else, and you're you're like, what's this guy on about and how does it affect me? The musculoskeletal system in the body is essential for several functions, not just movement, not just practical everyday being able to get up and do what you want to do. It's also really key in holding something in the body, not Guinness, sorry, this is just the glass that I had. It's important for holding water in the body. So you might have heard the saying before that water is making up 80% of the muscle tissue in the body. That's semi-accurate, and we'll go on to this a bit more in pathology later on, but your muscle is supposed to be mostly water. It's supposed to be gel-like. It's supposed to hold a lot of water in the body. It is responsible for not only the movement of your body, but also the respiration and digestion functions in your body. So helping you breathe and helping you to maintain an easy breath cycle. And this is when, as well, I'll do a video on this separately, because this video is really just to introduce the other videos. We'll go into talking about how the parasympathetic, sympathetic, or autonomic nervous system goes into fight, flight, freeze, and then there's another couple of F's as well, and how that is often the panic or the anxiety reaction in the body. We'll talk about the body's ability to be able to come out of that and come into rest and digest. So all of these systems together, I'm naming them individually, but they're all a matrix or a web that tie in together and ultimately affect your health. So that, if we're looking at the structure of those things, like the way I'm talking about them in kind of quite matter of fact or quite engineering kind of terms, your anatomical language is really about the structure. Okay, so I'm saying how it is. So we might talk about this room. It's a certain distance length. It's a certain distance wide. It's a certain height. And that might give us the idea of what the room is, but it doesn't necessarily tell us what the room does. So when we talk about physiology, when we hear the word physiology, that's more and more about like what the room does, how it works. There's a door here, people come in and out of the door. There's windows behind the camera, and apologies if we're getting any sound coming through those windows today, but it's actually a really warm August day here in Ireland. I have to have the windows open because it's absolutely roasting. So that tells us more about how the room functions. People get in and out through that, and then air and light gets in and out through the windows. So that's kind of like what we talk about by physiology, how these different structures in the body work, how they tie together and how they allow function. And when we're talking about pathophysiology, pathology is a look at disease process. So when these structures and when these functions are not in harmony, when they're not in balance, what's happening to put them out of balance, and what processes are maybe domino affecting. So one might fall over and then that might affect the next one. How these effects cascade through the body and how they can ultimately lead to serious or chronic long-term issues with the body. And what I want to really talk about more so than pathology is how we treat or how we remedy or how we help the pathophysiology or how we help the disease process, particularly regards to the neuromusculoskeletal system, the nerves, the muscles, the soft tissues, the bones, how we help and how we can remedy that. Because as we age, as we live longer, and in society nowadays we are generally living longer lives with more disability, I feel there's a missing gap within the conversation and within public health. We don't talk about our musculoskeletal systems enough. We tend to talk about when they're injured, so that's a big field of medicine. That's where I cut my teeth, was in a sports physiotherapy clinic, working a lot with sports injuries. We talk a lot about injury in the younger population, in the athlete, and getting them back up and moving. And we talk a little bit about the older person as well, but there's this kind of missing gap of the busy, stressed people who are driving desks and who are working really hard, people getting up and going to work early in the mornings, the people who are looking after kids at home or looking after loved ones at home, working from the home, people who are caring for others, and they're really busy and they're really stressed, and how the stress is kind of held in the body. And you can just, you can see it sometimes in people when they walk into the clinic and you hear their stories and what's going on. You know, how are we holding our bodies and what's held in our bodies, throughout the majority of maybe our working life. So I think there's a piece there around how we hold stress as well. I'll do a video around that. So to start to wrap this up, I'm really all about trying to give practical strategies and techniques, practical hands-on and practical needle treatments to be able to try and affect this tension which happens in the system. And we'll do a couple of videos on that as well. We'll talk about fascia and biotensegrity and where that term comes from, and how tightness and chronic trigger points can form in the body, and where contraction can form. And we'll have a look at pain, and we'll have a look at how those systems all work together. So thank you very much for having a listen. If you'd like to subscribe to the channel, please go ahead and do that in one of the boxes, which is going to pop up in one of the corners or somewhere on this video. If you'd like to connect with me on social media, you'll find the links in the show notes as well. Thank you for tuning in and having a listen. I hope you get some benefit from these videos, and I hope that you learn something. And if you'd like to be a case study, if you'd like to send questions in to me, please, I'm really, really welcoming of them. You can find some details in them, because I will be looking for case studies and people to say, hey, I've got this problem going on, can you talk to me about this? You're more than welcome to ask me a brief question. I can't give any specific advice about your condition without assessing you, but I can give you a general chat about that. Okay, Thanks, guys. Have a great day. Hooroo.